Ghazi. And with this, well, we are going to be moving on towards our next segment of the program. Today, we have been pondering so much upon the lines of healthy habits and good health in general as well. But with this, moving on towards the next segment of the program today, a large part of the program has been dedicated to diabetes and diabetes education. Now, currently joining us on the phone from Jeddah is Dr. Mustapha Al-Jawadi, who is a public affairs director, and we are going to be talking to him more about diabetes during the month of Ramadan. So diabetes and fasting, basically. Assalamu alaikum, Dr. Mustapha. How are you doing? Good morning.
Good morning. Wa alaikum assalam. Thank you very much for having me in your show.
It's our pleasure to be having you with us, Dr. Mustapha, and especially at this particular time before the month of Ramadan, where people can actually give lots of efficient and smart messages to their brain in advance as to how they are supposed to go about with the whole month of Ramadan. Now, particularly pertaining to this subject, Dr. Mustapha, tell us what is the percentage of people with diabetes in general? So, I mean, we can think about how many people with diabetes would be fasting during the month of Ramadan.
Diabetes is a major disease that is coming through the community very strongly and heavily. As you can see today, that the International Diabetes Foundation are mentioning that 23% of the global have diabetes. We are in Saudi, the 7th place country that have diabetes among their population. Today in Saudi, we can say about 1 out of 4 have diabetes. And this is not a small number. This is something that really we should take take good action and pay attention to.
Mm-hmm. So as you mentioned, Dr. Mustafa, it's almost 25%, which is a lot actually.
Yes.
What is the main reason actually? Besides, like, is it our food habits? Is it not exercising?
Yeah, I agree with you 1,000,000%. This is the main core of the disease. What we are really facing in today, especially in the new generation and population, we are having very bad habits regarding the way we eat, the time we eat, and we're lacking a lot of exercise. Now you can see a lot of junk foods going on in the country. People are eating in different times, and most of our food are more focused on the carbohydrates, the sweets, the sugars. And on top of that, we're not doing any kind of exercise. Mm-hmm. This all accumulates together and makes things much worse in the disease. Mm-hmm. So what we really need to pay attention is that we really need to focus more on the way we eat, how we eat, when we eat, and at the same time we should focus also on our exercises. All these things will help. If we have diabetes, this will help to control it. Or if we don't have diabetes, this at least will play a role in preventing or delaying the disease itself.
Absolutely. And Dr. Mustapha, as we know that education plays a great part, education and awareness when it comes to diabetes, to any of the chronic illnesses or any of the very, very critical illnesses, even for that matter. They say that education could help a lot. But tell us about, as well as medication, how important is medication for people with diabetes, and as well as how important is frequent monitoring of their blood glucose levels?
Education is a very crucial part for all patients with diabetes. Basically, what they should know is how to deal with the disease. This is a disease that's not going to go away. When you have diabetes, you will end up with diabetes. So the key question is, how can you handle your diabetes? What you should do and what you should not do. This is why a company like Sanofi, which is a global leader in diabetes, we contribute to our community through different programs. Basically by education of the physicians on what's the new guidelines, what's the new trend of the treatment, what's available in as a guideline. At the same time, we play a role in educating the patient themselves and how to deal and how to handle diabetes. We have a program with National Guard called Tamkeen, and this is basically directed to the patient, pediatric children who have diabetes and their families, to support them to understand how they can handle the disease. Today, we're very proud to say, since the last 3 years, globally in the GCC region, we have something called the ambassador, diabetes ambassador, that this is a person that who usually speaks to the patient. So it's a patient speaking to the patient about the disease, about how he's facing, about the difficulties, what he should do, his experience, and all that when it comes from a patient mouth to another, it will reflect much highly on the perception of how to handle diabetes.
So you mean like a support group?
Yeah, as a support group, exactly. What I really want to focus and highlight is that the key in diabetes basically is how you handle diabetes. This is what you really need to focus on, and this is what you really need to understand, because this is what will improve your quality of life and you will enjoy what you have. So basically, try to look at diabetes from the positive standpoint, that this is something, it makes me, running into these disease cases, but I have to work hard on myself to at least know how to manage, how to address my issues, how to control my life. So at least I live a very happy and enjoyable life.
Yeah, and Dr. Mustapha, as you're talking about controlling diabetes, and maybe some people were trying to avoid diabetes as well, how would we spread the awareness actually of diabetes and the ways to avoid diabetes, and for those with the diabetes, how to control it, like through media, and maybe school maybe plays a major role? How would we be active in this field?
Basically, what we can tell you is that contribution, like Sanofi contributions today in this regard, that we are being involved with the schooling system to educate the students. Whenever they have a student who have diabetes in their class, what they should expect, how they can handle with them, educate the teachers in the school and about diabetes. If you go out to that system and you go to at the hospital level, and you will find a lot of different programs that we are contributing as a Sanofi to increase the awareness at the patient level and at the physician level.
And are they enough, doctor?
You know what? Whatever you're going to do, there is more to be done. The key is that you have to continue working. This is not going to be something, it's a short period. You have to have long period plans. And this is something we're very proud of in Sanofi, that our plan in this regard is a long-term plan in order to achieve the best results. Again, I want to highlight that it will never be enough. Always there is more can be done because of the nature of the disease and the number of patients who is having diabetes. 1 out of 4 out of all population, this is not a small number. This is a number that really we need to pay big attention. And I can very proudly say the government of the custodian of the two holy mosques, MOH, Ministry of Health, are working very heavily with different institutions to improve that part and working with different pharma companies to have the best results in this regard.
Absolutely. But Dr. Mustapha, very briefly, before bidding farewell to you, I would like to ask you more about the month of Ramadan, as to how it is that people with diabetes could use the month of Ramadan as a great advantage for them to be lowering down their blood sugar levels and to benefit themselves.
Especially during the month of Ramadan, what really our advice is to the diabetic patient is that they have to sit down closely with their physicians. They have to understand how to handle the disease carefully during the month of Ramadan. They will be fasting for between 14 to 15 hours. It's summer. It's very hot. The weather is going to be very hot. So what they really need to be careful of is how they can maintain reasonable blood sugar that can keep them doing whatever their lifestyle, and they don't go into issues during the day. The next step is that during the night, after breaking iftar, they have to be very careful in not to go through and dig on these sweets, so they don't end up with elevating their blood sugar to a high level. So the control during month of Ramadan needs to be addressed in a very specific way because of our lifestyle. You know, usually you have sahur maybe an hour before prayer time. So this means that your sugar, you need to make sure about when to take your medication, when you should be your last meal, what kind of food you need to eat, especially at the late stage of the night. So my advice is that for those who have diabetes during the month of Ramadan, it really needs from them to work carefully on controlling their eating habits.
Mhm. Yeah, let me ask you a final question, Dr. Mustafa, about as we talk about diabetes in Ramadan. And as far as I know, there are some people who are able to fast and some people are not allowed even to fast. Is there a difference between the people with diabetes?
Yeah, definitely. If you are a patient who cannot control your sugar, this is the greatness of Islam. Yeah, whenever you have an excuse, and this is something being decided within your physician, yes, it's no different. And then there will be a time that you cannot fast because of your disease level or your poor control. And you will have all the time the excuse from the Islamic standpoint, from a religion. And that's what makes our religion extremely great and unique.
Certainly. And with this, Dr. Mustapha Al-Jawadi, we would like to thank you so much for joining us in today's edition of the Saudi Morning Show.
Thank you very much for having me in your show. Appreciate that. Thank you.
It's our pleasure. And also, with this, we hope that everybody would be able to live a better life with diabetes or any of the chronic illnesses that they have always had or that they have acquired during the course of their lifetime.